does sort of have that feeling.
But that's a good thing. They're all enjoying the nice weather. Yeah, exactly.
We've got nice weather for a few hours.
That's right. Take advantage of it.
That's right. All right. Pat, would you like to lead us in the Pledge of Allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, welcome to the January 9th Shawnee County Board of County Commissioners. On my right is Commissioner Kevin Cook, who represents District 2. And on my left is Commissioner Aaron Mays, who represents District 3. And I'm Bill Rippon, and I represent District 1. Good morning, everybody.
Morning.
Morning. Ben. First item.
First item is item 3, consent agenda.
I will move that we approve the consent agenda.
Second?
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business, A, County Clerk number 1, consider all voucher payments.
Commissioners, we have vouchers this morning that total $563,781.22. The highlights out of the voucher report: under health insurance, there's MedTrack, which is an assistance for our employees of $87,450.08. Under community corrections, which is a state grant, we have Gray Horse Farms LLC for $62,869.77. That's rent for the community corrections offices. And then under asset management for parks, we have Heinen Repair Services for $38,017.04, which is a new mower minus the trade-in for the old mower. And I do not have any questions regarding the vouchers and would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I'll move for approval.
I'll second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Parks and Recreation number 1, consider authorization and execution of contract C3-2020 with the Special Olympics Kansas, setting out the conditions for the 2020 Polar Plunge to be held on February 8th at Lake Shawnee, with a special event fee and expenses totaling $750 payable to Parks and Recreation.
Good morning, Commissioners. Randy Luby, Shawnee County Parks and Recreation. Before you today is the contract with Special Olympics for the 2020 Polar Plunge at Lake Shawnee. This event benefits Special Olympics. Their goal is to raise $25,000. This is the 16th annual Polar Plunge at Lake Shawnee. They have a 5K run or walk that starts at 11, and then the Polar Plunge at noon. They do have contests for the best costumes, the people that raise the most money, and the team with the most participants. And I was talking to Angela Lewis. She's going to try to gather a director's challenge or elected official challenge for the county to form teams, and hope to see you all out there. That was her idea, not mine.
We hope to see you out there too.
Not a director.
This 750, is that based on what we think they'll bring in, a percentage of what?
No, that covers our cost. There's a $500 application fee, and then $250 that covers our cost of cleaning the beach and getting everything ready to go before the event.
Okay.
Don't have any questions. I'll move for approval for this worthwhile cause.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0.
Thank you.
Thank you, Randy. Next item.
Item C, Public Works. Number 1, consider approval of request to issue multiple requests for quotations for the purchase of capital equipment items at an estimated total cost of $631,082, with $200,000 in funding from the 2020 Capital Outlay Fund and $431,082 in funding from the 2020 Special Equipment Fund.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. Back on August 5th of last year, the Commission kindly approved Public Works requests, capital equipment. And so now I'm before you today asking for approval to solicit bids or solicit quotations for the purchase of said equipment. Equipment covers 2 dump trucks, a message board. We have 1 message board. But you really need 2 message boards. There's 2 ends to a project, so we would like to buy a second new message board. We'd like to buy a patch truck, trailer, or a box, a hot box, and I'll get into that in a little bit. We would like to replace one of our sign trucks, traffic control trucks, and then buy a supervisor's pickup. Now, you'll notice on the sheet, we have 2 dump trucks with ancillary equipment. Normally, we buy a dump truck with a bed, and you take the tailgate off. You can insert a sander spreader for salt and sand, and then you can equip it with a snow plow, and it's kind of our standard piece of equipment for fighting snow and ice events. We'd like to do something different with the second truck. We would like to purchase what we call a hook lift load arrangement. Here you see that the truck is backing up to a Durapatcher. That's a spray patcher, and it's just an example of one of the pieces of equipment you can pull onto this truck bed. It hooks on, it lifts, and then it loads. The great feature or great advantage of this kind of truck, you can buy one truck itself, and you can buy a number of pieces of equipment that you can load onto that truck. For example, salt brine and sprayer, which we use, sand, salt spreader, and snow plow, dump bed, flatbed, and for Bill Sutton's benefit, solid waste refuge collection. Really what I'm here for, though, is to talk about this hot box. It's a patch truck. Again, it would work. You'd pull it up onto the truck, and if you look in the memo that I sent, I talk about a patch truck, trailer, or box. If we go this route, we would buy this something like this hot box. This is actually from the city of Lenexa, and I think they've had good luck with theirs. So that hot box would be purchased for $95,000 in addition to the $395,000 for the 2 trucks. And in case you were wondering what our sign truck looked like, it's just a standard Super Duty pickup with a large tool box in the back, and the device on top of that, what it does is it drives and pulls signposts. This equipment will be purchased with $200,000 from the Capital Outlay Fund. More specifically, that $200,000 will be applied to the 2 dump trucks, and the remaining funds will come out of our 2020 Special Equipment Fund. Questions?
So the 2 dump trucks with ancillary equipment that's listed, that's for 2 of those ones with the lift? Or
No,
I thought you said one.
One standard, which is just the dump truck, and then you can take the tailgate off, insert a sander spreader and a snow plow. That's just a standard arrangement. We have, others like that in the county. This would be a different situation. It would be a new way of looking at this piece of equipment. We would buy the truck bed, we would buy the dump bed as part of that. We would buy the sander spreader, and also then we would buy the hot box, the patch truck.
What's the difference in price between
We think
the
it's,
standard dump truck
we
versus?
think it's going to be similar. We hope it's going to be similar.
Okay.
So what this gives us, again, is a little more flexibility, because you have one truck, you buy one truck, and you can use it for multiple things. We're gonna use this kind of an experiment and see how it works, and if it's successful, we might buy more of them.
Okay, the other question that I have also relates to the supervisor's truck, replacing that. It seems like kind of countywide, we've really been moving towards leasing programs. Is there a reason why this is just an outright purchase?
Well, because what I've understood from the people that have leased, that have more knowledge about it than I do at this point, if you attach two pieces of specialized equipment to that to that truck, it probably does not pay to lease.
Okay,
And typically, our trucks are so specialized in what we do, it may not be satisfactory to lease for this piece of equipment. But I can assure you, we will look into the leasing. I'm presently will be working with Enterprise to see what we can lease in our equipment fleet.
okay, great, thank you.
Will this truck also have blades for the front?
Yes,
Instead of
yes.
Salt spreader?
Yes,
Okay.
yep, yep.
Mr. Chairman, you showed a picture of a solid waste back for the dump truck, and you did not mention purchasing the solid
No,
waste
I just
attachment.
showed that as an example.
Are you thinking down the road you might be looking into buying that solid?
Well, over the past 15 months while I've been with the county, I know that topic has come up. I haven't really specifically talked with the solid waste director at this point. I think he has kind of some of his own ideas how they want to proceed with some equipment that has a little more flexibility. And I'll let him answer those questions when the time is right.
I think that if we get into a spot to where Public Works and solid waste would be sharing equipment or using equipment, there should be a cost share in that, because those are, again, two separate funds, one being an enterprise fund, the other one being our taxpayer funds. So just, I mean, we're not doing it yet, but as we get into that, if we get into that, we should have a cost share between the two different areas.
Understood. Thank you.
Any other comments, questions?
No?
I will move that we approve.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
Thank you, Karen.
Item D, Health Department, number 1, consider authorization and execution of contract C4-2020, a memorandum of understanding between Vallejo Behavioral Health Care and the Shawnee County Health Department to provide funding of up to $50,000 per year for 2 years to cover salary and benefits for a health promotion specialist to be hired by Vallejo.
Good morning, Commissioners. Linda Oaks from the Health Department. Today, we're asking your approval to fund a health promotion specialist to be employed by the Vallejo Behavioral Health Care and funded by the Health Department. I'm really excited about this new partnership because I believe collaboration is the key element to improving the health of our community, and this is a great step. So during this presentation, I'm going to refer to behavioral health, which refers to mental and/or substance abuse disorders. So what does behavioral health have to do with public health? Behavioral health is public health. We see the rate of tobacco use among people with mental disorders is nearly 1.5 times that of the general population. Also, we see suicide is ranked as the 3rd leading cause of death for youth 10 to 14, and the 2nd leading cause of death among people 15 to 34 years of age in the United States. And this is what we're seeing in Shawnee County, and I'm very concerned about this. We're seeing the trend, the upward trend of age-adjusted suicide mortality rate. And you might remember Lynn Lee, our epidemiologist, reported that in 2017 and 2018, there were 16 suicide deaths and at least 803 suicide-related emergency department visits among Shawnee County residents aged 10 to 24. So I do think we have a problem here that we need to be addressing. Also, according to the Substance Abuse and Mental Health Services Administration, or SAMHSA, 60% of premature deaths in persons with serious mental illnesses are due to preventable and treatable medical conditions, and persons with serious mental illnesses have health care costs that are 2 to 3 times higher than the general public. And so why is this project important to our community? So this is, one of the outcomes being measured by Momentum 2022 is Poor Mental Health Days. And this is a shot from their dashboard, from their My Sidewalk dashboard. So, and you can see in the map some of the areas of the city where the rate is higher. We also know that this outcome does drive our county health ranking. And you've also heard a lot recently about our new community health improvement plan based on our community health needs assessment. When we did the assessment, mental health was ranked as the #1 health problem on the survey, and access to mental health was rated as the top issue in the town hall meeting. So when we created the community health improvement plan, behavioral health came up as the first priority area. So these are a couple of the goals that we'll be working on. One is to decrease the suicides in Shawnee County. As I mentioned earlier, we are having an issue with that. And the other goal, to create an integrated system of care to address crisis through recovery and prevention, so that access piece. So we see this position working in these areas and working on the CHIP. And the Community Health Improvement Plan, that is our community's health strategic plan. So we're going to be referring back to that as we bring forward new projects. So this is one of them that will definitely relate directly to the CHIP. So this picture is from an infographic from SAMHSA showing what a public health approach to behavioral health looks like. And I've circled the areas that I feel like this position will be impacting. So strong partnerships across community programs. This is a great partnership. We already have great partnerships with Vallejo and the county, so this is one more. Public health education programming and public mental health education programming. Increased use of health information technology, and of course increased prevention efforts. So I think another thing I think is important, this is a little bit different, it's a little outside the box, but I think that's what we need to be doing to impact the health and improve the health of our community. Public health is not just the health department's job, it's everyone's job. So we're trying to help make those connections and bridge those areas. So now I'm going to ask Bill Persinger, who's the CEO of Vallejo Behavioral Healthcare, to come up and add his comments to this agreement.
Thank you, Director. Commissioners, thank you for your support. I'm Bill Persinger, the Chief Executive Officer at Vallejo Behavioral Healthcare. I want to take this opportunity to thank you for your support in the past and hopefully into the future. It's an outstanding proposal before you, in my humble opinion. The thing I want to do is put this in context for you for the Mental Health Center. We're doing a lot of work in the area of what's called integrated healthcare, which is, partnerships and collaborative relationships in the community to target prevention and education, help people prevent bad health and maintain good health. Also direct interventions through medical and mental health treatments, and then follow-up. So there's so many things that the Mental Health Center is doing, and one of the great things we do is a good relationship with the county health department, some common projects. They help Heartland Healthy Neighborhoods. When I first got here, Commissioner Bueller said, "Bill, you need to go to these meetings." And it was Heartland Healthy Neighborhood. I'm like, "Yes, ma'am, I will do that." So I've been going ever since. We participate in several of their initiatives, have 3 or 4 of our executives from Vallejo assigned to those committees and work groups. And so this project would be one proposal to hire a new person at Vallejo. We may hire from within. We don't know if it's approved by you folks, but will definitely be a new position, doing new work, and targeting ways to engage people in mental health and addictions, to do health promotions and educational activities in the communities to promote awareness, get people plugged into services, both mental health and so on. We're doing so many things. We're working with the city and the county on what I call the paramedicine van, the kind of rolling healthcare vehicle, if you will. Doing some work with Stormont Vale and others in reaching out to the community, bringing health care and mental health care to the streets, getting people early into health care services and mental health services. Just a number of initiatives going on. This will fit with so nicely. Director Oaks made a great case for the context of this position, but we want you to know it's very consistent with the current mission of the Mental Health Center, not just to provide mental health care, but to try to treat the whole person in a place where the person is. A good county-wide effort that we think will target people with health problems, people who are at risk, people who are uninsured, people who for whatever reason can't access care. So we try to get into the hard places where people are hard to reach. We've become an active partner from the get-go with the Impact Avenues program, which is a one-stop shop clinic nearly every Thursday up at the Garfield Park North, where individuals who have signed up can come in and walk in and sit down at a mental health table, They can sit down at a table that deals with housing and personal finance and their educational classes. We can actually get people enrolled in mental health care in a place other than driving up to the mental health center, which is always something a person can do, but it's just a great way to reach out to people who would probably never, get engaged or re-engaged with mental health. So this person will be assigned, if it's approved, at least a half a day a week to work with the IMPACT program here locally, which serves the whole county, but just a number of other activities that we will create and also become a part of. So I would stand for questions, and I want to again thank Craig and Linda for their support.
Also, I would stand for questions. One thing I want to add, this conversation started last summer when we did budget hearings, and we talked about how can we help other agencies, and we really felt mental health because of the CHIP was the way to go, and this partnership with Bill. And I also want to thank Betty Griner for helping us. As I said, it's a little outside the box, so helping us connect all the dots and make it work. So, would we have any questions?
I just want to reassure the commission is, if approved, be new money spent for a new position. We're not going to supplant, we're not going to replace. This will spend every dollar on new services.
And I would also mention, this is a pilot, so we did 2 years, and then we will be reevaluating as we go and at the
The
end of that.
outcome measures along the
Yes.
way, how are we doing, where are we short, where are we long, where are we weak and strong.
Chairman? Linda, the Topeka and Shawnee County health rankings has been very troublesome. As we've seen our numbers, we've struggled with where our rankings are at and watching our numbers go down. And there's always a lag between what's reported and what we're doing now because the data, it may be a couple of years old. The Community Health Improvement Plan identified mental health and behavioral health as being one of those key things as you identified. Do you believe that this is really going to get to the root of that issue on the Community Health Improvement Plan and start to address some of those concerns?
I think it's a start at that. You're right. We have many years, it's a big problem. But yes, I do think it's a start because of the fact that we are joining forces together. I think that we have to have the people doing the work. So yes, I do think it will make a start in that. I think as we go through the next few years, we'll find other programs and other processes that we want to put into place that will also help with that ranking. But I do believe this is a start.
Is it your belief that the Kansas health rankings are based on the impact to the total population of that county in initiation of a project? I mean, how many people is it going to impact? For example, Allen County instituted their grocery store in a food desert,
Yeah.
and they watched with that one initiative their health rankings jump
Right.
tremendously. Whereas Shawnee County may have a number of projects, but they aren't hitting the same percentage of the population because we have more people than Allen County would have, so we're not seeing the same impact on our increase in health rankings. Is that what is that an accurate observation?
I do think it's an accurate observation. And I think another example I would use is Wyandotte County. So Wyandotte County continues to be at the bottom of the health rankings, yet they have instituted a lot of great programs, and they're seeing some improvement. It's just not showing up yet. But yeah, Allen County may have something else happen because their small population may be back down at the bottom the next year. So it's just a reference. It's just a tool for us to use to look at what we need to do as a community. But it's not the only tool. It's probably not the most important tool, but it does get a lot of attention.
So if Shawnee County wanted to see a huge jump in their health rankings, we would have to roll out a program that would impact a significant or large percentage of the Shawnee County population, correct?
Correct.
And this isn't going to do that, but this is going to improve that one component of the Shawnee County population.
That is correct.
So we're probably not going to see from this one pilot
No.
a huge jump in our health rankings.
No.
And so as the director of the health department, are you more concerned about Shawnee County's health ranking number or the impact to those that are most in need?
Well, yeah, I'm definitely more concerned about the impact to those in need. I mean, I think the suicides, that is concerning to me. The young people that are committing suicide, that are attempting 803 emergency room visits, that concerns me. I want to impact those folks. I want to have some help for people who need the help. The rankings, it's just a number.
Okay. So as the commissioners, we should probably not be so laser focused just in on our grade. We should be impacted on the quality of the product.
That is correct.
Okay.
But we will probably always use those county rankings to call attention to areas we want to improve on. I think they're good for that.
All right, thank you.
Want to add anything to that,
I was
Bill?
just going to say, a specific example is the impact program, just the referrals to Vallejo alone, actual, people sitting down at the table with us at Garfield, well over 30 people so far, 35 people that we would not have impacted, and they followed through and getting care. I think that this is one of a number of things that we can do. Of course, some big things that could happen in our society that I think would have a really great needle-moving impact. Fully addressing the methamphetamine problem, getting health insurance for people, early intervention, reducing emergency room overutilization, a lot of things like that. This would be one important part of that, Commissioner, and I think we will have a direct impact on people. We'll do our best to measure that, at least on the people that we reach out to. But taken in context with everything else going on, I think it's a move in the right direction.
Will this new position focus primarily on younger people, or is it across the board, or?
So, the activities that we see this person being involved with could definitely involve younger people and families. Some of the highest risk individuals that we have in terms of their health and their current health status, the behaviors that we see, the suicidal risk, the mental health crises, people that don't have primary care doctors. Those would be try to focus on the adults. I think we'd have a real quick impact there. But we're not going to get in the child serving business. We leave that up to our partner, Family Service and Guidance Center. But we do often get engaged in the same community events along with the Guidance Center and, the YWCA and others that are out there providing health and prevention services to folks. And so, Commissioner, I think we probably have a chance to impact some children, but I wouldn't want to stand here today and say that, we're going to target that group. They'll be a part of the events that we'll be a part of, create some new events and some activities, and get that information out there. But, so the idea is to address the general population. But, Vallejo's focus will always be on adults. There are a lot of immediate high-risk concerns we have with adults who are suicidal and have acute mental illness, and, people addicted to drugs, people that have bad health, diabetes, high blood pressure, other kinds of problems that we're going to target, I think, the quickest and the soonest. But there are some great initiatives going on to, address children or mental health needs, or increase services in the schools, and Family Service and Guidance Center doing some other things in that realm. But we anticipate being right there with them, Commissioner, but general population focus.
And of course, anything we do to assist the parents is going to assist the kids. I mean,
Which is
so.
a lot of what we see at
Yeah.
the impact avenues, a lot of what we see when we work in the paramedicine vehicle with the county and the city, a lot of what we see in our CIT program on the street. If we feel like we're helping parents, we're helping family, helping kids. I don't mean to say, Commissioner, that'd be incidental to kids, but our focus will be initially on adults and families.
Any other questions, comments?
I'll move for approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Thank you, Commissioner.
Thank you.
Item E, corrections, number 1, consider authorization and execution of contract C5-2020, a memorandum of understanding between Shawnee County Juvenile Detention Center and Haley Counseling Services to facilitate the Family Peace Initiative Program to expand services to youth to include psychoeducational groups for males at a cost of $14,910 to be paid from the inmate wellness account.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. This is a continuation of a program that we started last year that we found very good results when it came to addressing those juvenile offenders who came to the Department of Corrections with a high risk of violence or abusive or assaultive behavior. A part of our accreditation through the American Correctional Association, one of the things that we're asked to do or mandated to do is to identify those juveniles who are high risk for assaultive or aggressive or violent behavior. But not only do we have to identify those, when we do a good job identifying those, we have to provide programs. And listening to Linda and Bill talk about, a tremendous segue into this is that part of the community is the jail and the programs that we have to provide. And we also try to do an integrated philosophy as in bringing in our partnerships. I've known Steve on, Hallie, on other committees when it came to domestic violence. This is a program that will engage those juveniles to identify and be able to deal with conflict resolution, being able to provide avenues to safely stay away from assaultive behaviors. And, you know, with the Senate bill that came out, the 367, you know, and diverting those low-level offenders, the offenders we're seeing in the juvenile detention center are those who are the highest level of risk for this. And one of the things that I found out is that about 89% of the juvenile detention population has been engaged or is, they're engaged in violent or assaultive behavior, or they're coming into jail for those types of things. So this is a program that we see hits the nail on the head. That this program will be funded through the inmate or juvenile health wellness account, which, and I think every once in a while it's a good reminder for everybody that we have an inmate or juvenile wellness account, which is based off of the a percentage of money that inmates or juveniles spend in the commissary. That percentage, which is about 34% that we get, we put back into an account that deals strictly with juveniles. We work closely with Betty Griner in audit, finance, and administrative services in monitoring and keeping that account in compliance with the needs. But this goes to, my message is that the inmates or the juveniles are paying for this. I'm not asking for taxpayer money to come into the jail for these types of things. The juveniles and the inmates are paying for these services. So, but this does help us meet and exceed our standards and to maintain our compliance. It helps us to be able to provide a valuable service. We're seeing a tremendous impact, meaning we're seeing less use of forces. We're seeing less violent acts of juveniles, and we do believe that this is a direct result of the professional services that Hallie Counseling Services provides to the Department of Corrections. So with that, we've gone through all the preliminaries of the contract being looked at for legalities and forms and things like that, so I'd stand for any questions you may have.
Brian, can you talk to the public and to those that may be watching? The inmate wellness account is funding this, and you've identified it as not being tax dollars.
Yes.
Where does the money come from for the inmate wellness account? If we're talking about a juvenile probably doesn't have a job, probably doesn't have an income. So who's contributing to this inmate wellness account?
Very good question, sir. Thank you. Typically what happens is that for the adults and the juveniles, sometimes they will come in with money, but we allow inmates and their families or friends to put money on their account to allow them to buy services or commissary. So the money that an inmate would get does come from their families or friends. They can come up to the jail, they can do it online, and they can put money on an offender's account. So that money is there. Every juvenile or adult inmate has their own personal bank account at the Department of Corrections, and our records monitors each of those along with Betty Griner and her staff. And then what happens is that they use that money and they will buy. We provide commissary services where inmates can buy hygiene stuff, toothpaste, shampoo, soap, candy, chips, things like that, programs, materials, writing materials. If they have money, if they're indigent, we provide that stuff to them. But when they buy stuff through our commissary, then we take the commission off of, a percentage of the commission goes back into the account. Is that the best way to say it, Betty?
Okay, so if Commissioner Rippon is in jail and he wants to buy some toothpaste and a toothbrush.
Yes, sir.
And it costs him $3. There might be a commissary amount back to the county of 50 cents.
Yeah.
And from that 50 cents, over time, it builds up. And that's where we see that we pay for things such as the cable that's
Yes.
in the modules. If there are reading materials, or if there's things that are outside of the operations, such as the inmate wellness, those all go from the inmate wellness account.
Yes, we're talking about programs, we're talking about basketballs, we're talking about TVs, the tablets, telephones, the cable, the things that go above and beyond the inmates pay for. And, you know, and I think that's a good point, that a lot of times people get the understanding that, hey, look, we don't want to be too fluffy or too cushy for those who are in jail. You have to remember, unlike a prison, the majority of people that I have are not convicted or sentenced to anything, number one. So we have that. Number two, they have rights to different things. So when it comes to the law library, the inmates pay for those things. So a great deal of the services that you see that we provide, while they're very good and evidence-based, the inmates pay for those, and that's based off of the money that we get back.
Thank you.
Say Commissioner Cook was a juvenile. You give them any opportunities to do tasks or work at the jail where they might get some pay to use at the commissary?
Well, we had some sanction house type things years ago that came to where that, but our accreditation and the Fair Labor Standards laws and things like that are very strict when it comes to offender work. Do we have module worker positions that they can do some different things, or some things in the modules, a garden we have at the facility and things like, the answer is yes. But when it comes to work details, there's a very strict line that allows us that the juvenile offenders can work. But we do allow, the way I base juvenile detention is, it is more programs with corrections, and adults is more corrections with programs. And that's where we try to develop, and that's why when we meet and exceed our accreditation, is because of the programs that we provide that are needed to help our juveniles become better, because they are going to get out into the community, and we have to give them the skills and things that they need, so they're not just repeating that cycle of coming back to the jail.
Any other comment? Yes.
Yeah, Brian, I think this is great. I think it's something that long-term would help decrease our violent crime in Shawnee County, because, as you said, they will probably get back out here pretty soon. And I think it's always good, anything we can do to make our correctional system a little more rehabilitative rather than, you know, punitive. So it's good to see this. I hope it's widely successful. And
Well, our plan is, Commissioner, is that I want to do this for another year or so, as long as we keep seeing the results, and then we start talking with this group of moving it over to the adult. I just want to continue to get the success that we're seeing on the juvenile side, and there is talks about doing this on the adult side, because we see some of the same problems, yes.
yeah, I'll go ahead and move for approval.
I'll second. Motion's been made by Commissioner May, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you very
Ron.
much.
Next item.
Item 5, Administrative Communications.
Okay, we'll take this opportunity for staff to make their announcements, or anyone from the public who would like to address any issue.
Good morning, Commissioners. Bill Sutton, Solid Waste. I just want to give an update on our electronic recycling that we do at the Household Hazardous Waste Facility. We have been accepting CRT tubes, or cathode ray tubes, the big monitors, since last year on a cash basis. We now have the ability to take credit card or debit card out there. The price is 19 inches and below is a $15 fee, and 20 inches and above is a $30 fee. And again, that's at the Household Hazardous Waste Facility, 131 Northeast 46th Street. Thank you.
Thank you. Anyone else? Commissioner Mays.
Nothing from me.
Nothing you. Commissioner Cook.
Nothing today.
Well, I know Commissioner Cook and I attended the Weed Department's annual breakfast, and John Wellborn did a nice presentation talking about weeds and concerns that we have in that department that concern Shawnee County. John also, this is his last year, he's gonna be retiring, so we're gonna miss John with some big shoes to fill out there, and we wish him the best. And I attended the farm show, so I didn't get up and sit in the John Deeres, but I wanted to. But it was a good event as usual, and it looked like it was well attended, so that's it. Next item.
Item 6, Executive Session.
We have no need for executive session, so we're adjourned. Have a good day.
Well, Commissioner, maybe Mr. Niehaus will let you drive the dump truck.
As long as you have a CDL.
I do not, so it's just,
Y'all, not the trash truck. I drove dump trucks.